Hello, this is Dr. Steele. Today I want to talk to you about the role of vascular ultrasounds. Remember, in medicine, the way I practice medicine, we do three things. I use the letter P for prevention. To prevent is to prolong life. What can we do today to live another day, week, month, year, 10 years? I use the letter D for detecting early. What tests or what evaluation can we do to detect something early, with the disclaimer that especially cancers are very sneaky, but everything else, heart disease, vascular disease, that are more common in diabetics, and as we get older, we have a lot of tools that we can use and utilize. The other letter that I use is control, C for control. What is it that can we do today to control either the most common problems, right? If we have, as we get older, diabetes, sugar problems, let's figure out a way to control that. If we have problems with our blood pressure, right? Those vessels are constricted, high blood pressure. What can we do to correct that or to control that? If we have problems with cholesterol, because cholesterol as sugar is sticky, sticks to your vessels and blocks those vessels as we get older, what can we do to control that? And of course, deficiencies, vitamin D deficiency, thyroid deficiency most commonly, and of course, the deficiency of testosterone in men. So those things we need to keep in mind to be able to delay the inevitable, right? We're still going to go one day, but we're focusing on not only living longer, but quality of life. So right now, the ultrasounds that I want to mention are the carotid ultrasound, the vessels that are in your neck. It's called carotid. In Latin means carotid cara, face, because it irrigates your face and the main parts of your brain that commonly are affected by a stroke. And I'm talking about ischemic stroke. And it's very important to differentiate between ischemic stroke, when those vessels get clogged because of diabetes, hypertension, or a blood clot that can come from your heart if you have something called an arrhythmia, AFib, atrial fibrillation, versus something called hemorrhagic stroke. That happens when we all of us get older and those vessels just pop. It can happen at a younger age. We have something called a malformation, like an aneurysm, but most commonly as we get older, we can have a hemorrhagic stroke. So those tests, especially in diabetics, we want to screen those patients with or without symptoms in my way of practicing medicine, because I have actually diagnosed a lot of people with carotid disease, vessels that are clogged and they need to be opened up. And we also have diagnosed many patients with vascular disease, which is also called peripheral vascular disease. The big vessels, not the little ones, the big vessels that can lead to an amputation of your toe or your foot. So it's important to remember that we need to not only listen to our patients, but we need to start thinking about complications of our patients. And we're not going to wait until somebody has an amputation to say coulda, woulda, shoulda, or a stroke, right? So that's my message for today. The vascular ultrasounds are a great way to evaluate or to detect early, especially with patients that I have with diabetes, because diabetes puts you in a high risk for those vessels to get damaged and clogged. That's my talk for today. Continue remembering that the greatest wealth is health. Talk to you soon.